Are you or someone you know living with chronic kidney disease? If so, it's important to understand the potential complications that can arise, such as anemia. Anemia occurs when there are not enough healthy red blood cells in the body and is a common complication in CKD, affecting more than 1 in 7 people with the condition. Anemia can cause a range of symptoms, including fatigue, weakness, and shortness of breath, which we're going to discuss more. Early detection and correction of anemia is important in order to improve outcomes for patients with kidney disease. I'll provide an overview of the causes, symptoms, diagnosis, treatment options, and complications, and ongoing research related to anemia in CKD. By understanding these factors and taking action early on, you can help manage your condition and improve your overall health and well-being. Are you tired of struggling with your health? If you're someone living with chronic kidney disease, I've got great news for you. Hello, I'm Mathia Ford, a registered dietitian nutritionist specializing in chronic kidney disease and owner of renaldiethq.com. I specialize in helping people just like you improve their health by making simple yet delicious changes to your meals. Together, we can transform your eating habits, boost your overall well-being, and ensure that you're enjoying every bite along the way. Say goodbye to bland and boring meals and say hello to a healthier, more vibrant life. Let's get started on this incredible journey to a better health together. Visit renaldiethq.com today and take the first step towards a healthier lifestyle. Anemia is a common complication of chronic kidney disease and can cause symptoms like fatigue, weakness, and shortness of breath. Iron deficiency is a common cause of anemia in people with CKD, and treatment options include erythropoiesis stimulating agents, or ESAs, iron supplementation, and red blood cell transfusions. Anemia can increase the risk of cardiac disease or heart disease and strokes in people with CKD, and early treatment can help slow the progression of your disease. Researchers are now actively studying new treatments and potential underlying causes of anemia in CKD. In CKD, anemia is a common complication that can significantly affect your health. There are several mechanisms of anemia that contribute to the development of this condition. First, impaired kidney function affects the production of erythropoietin, EPO, a hormone produced by the kidneys that stimulates the production of red blood cells in the bone marrow. As your kidneys become damaged, they are unable to produce enough EPO, leading to decreased red blood cell production and subsequently causing anemia. Additionally, CKD affects the balance of iron in your body. Iron is essential to produce hemoglobin, the protein responsible for carrying oxygen in the blood. In CKD, iron deficiency often occurs due to decreased absorption of iron from the gastrointestinal tract, inability to produce enough EPO, and blood loss during dialysis. Insufficient iron levels result in inadequate hemoglobin production, exacerbating problems with anemia. Furthermore, CKD can lead to the accumulation of uremic toxins in the bloodstream. These toxins can directly impair the function and lifespan of red blood cells, contributing to anemia. Additionally, inflammation associated with CKD further worsens anemia by suppressing the production and response to EPO, impairing iron metabolism and accelerating red blood cell destruction. Treatment of anemia may include erythropoiesis stimulating agents, or ESAs, to stimulate red blood cell production, iron supplementation to correct iron deficiency, and blood transfusions in severe cases. Regularly monitoring your hemoglobin levels and working closely with your healthcare team are essential to effectively manage anemia and improve your overall well-being. The symptoms of anemia and chronic kidney disease can vary, but some common symptoms include feeling tired, weak, fatigued, short of breath, and experiencing headaches and chest pain. These symptoms can be caused by a lack of oxygen in the body due to a shortage of red blood cells. It's important to note that these symptoms may also be present in other medical conditions, making accurate diagnosis critical. It requires laboratory testing to determine the number and size of red blood cells, hemoglobin levels, and the number of developing red blood cells. This process helps differentiate anemia from other conditions with similar symptoms. Early detection is key, as treatment effectiveness is dependent on identifying the underlying cause. Whether it's iron deficiency or a different vitamin deficiency or not making enough red blood cells, all of those can be figured out with the blood test. And once diagnosed with anemia and chronic kidney disease, it's essential to receive your proper treatment as soon as possible. Accurate diagnosis and timely treatment of anemia are critical for managing your condition effectively and improving your overall health outcomes. If you have CKD, there are several risk factors that increase your likelihood of developing anemia. First, the severity and progression of your kidney disease play a significant role. That's also known as your stage and how quickly you progress. As your kidney function declines, the risk of developing anemia increases. If you have advanced CKD or end-stage renal disease, the chances of developing anemia are higher. Other risk factors include the presence of comorbidities or related chronic illnesses like diabetes or hypertension, which are common causes of CKD. These conditions can further worsen the kidney function and therefore contribute to anemia. Additionally, certain medications commonly used in the management of CKD, like ACE inhibitors or angiotensin receptor blockers, may increase your risk of anemia. This doesn't mean that you shouldn't take them, but you should talk to your doctor about it. Furthermore, nutritional deficiencies can play a role. Inadequate iron uptake or absorption of vitamin B12 or folic acid can contribute to anemia in CKD. It's important to ensure a balanced diet and appropriate supplementation if necessary. Your gender also plays a role, as anemia tends to be more prevalent in females with CKD compared to males. Hormonal factors, including menstrual blood loss, contribute to this increased risk. Understanding these risk factors can help you and your healthcare team identify and manage anemia effectively. Regular monitoring of your kidney function, nutritional status, and hemoglobin levels, along with appropriate interventions and treatment for anemia, can help mitigate the risk and impact of this complication. Let's explore some ways to treat low red blood cells in chronic kidney disease. Iron supplementation is often used to increase the production of red blood cells. In fact, non-dialysis patients should maintain transferrin saturation above 20% and ferritin above 100 nanograms per milliliter by taking iron supplements. However, it's important to note that transferrin saturation should not exceed 30% and ferritin levels should not exceed 500 nanograms per milliliters. In some cases, blood transfusions may be necessary for severe anemia in CKD patients. However, this treatment option comes with its own risks and should be discussed with a healthcare professional. Another treatment option for anemia in CKD is the ESAs, which we talked about, which stimulate the bone marrow to produce more red blood cells. While ESAs can effectively treat anemia, they do come with potential side effects like high blood pressure and increased risk of heart attack or stroke, so they should be used with caution. In addition to medical treatments, dietary recommendations, hello dietitian, may also help manage anemia in CKD patients. A dietitian can develop a meal plan that includes foods rich in iron and other nutrients needed for red blood cell production. If you're taking iron supplements, a way to get better absorption is to take them with a source of vitamin C. Overall, treating anemia in CKD requires individualized care and attention from a healthcare team to find the best approach for each patient's unique situation. I'll link to the chart in my blog post about different treatment options for you to review in the description below. Managing the complications of low red blood cell levels in chronic kidney disease is crucial for maintaining overall health and quality of life. Anemia in CKD can also worsen cardiovascular disease. With reduced oxygen carrying capacity, your heart must work harder to pump an adequate amount of oxygen to the body's tissues. This can lead to an increased risk of heart problems, including congestive heart failure, angina, and abnormal heart rhythms. Furthermore, anemia can negatively impact your kidney disease progression. Insufficient oxygen supply to the kidneys can further damage the already compromised renal function, leading to a vicious cycle of worsening kidney health. Anemia also affects your body's ability to fight infections and heal wounds. With a weakened immune system, you are more susceptible to infections and have a slower recovery rate. Additionally, anemia has been associated with cognitive impairments and decreased cognitive function in CKD patients. This can manifest as difficulties in concentration, memory loss, and overall mental sluggishness. By managing your anemia, you can reduce the risk of complications and improve your overall well-being. When you have chronic kidney disease, iron deficiency is a common concern that can significantly impact your health. CKD often disrupts the normal balance of iron in your body, leading to insufficient iron levels. There are several reasons why iron deficiency anemia occurs in CKD. CKD can disrupt iron metabolism, so the kidneys play a crucial role in the regulation of iron levels by reabsorbing and conserving iron from your blood when they process. However, as kidney function deteriorates, this regulatory mechanism becomes impaired, leading to decreased iron reabsorption and increased iron loss through urine. This contributes to iron deficiency and exacerbates renal anemia. Dietary restrictions and poor appetite are common in CKD. These restrictions, coupled with decreased iron absorption in the gut, can further contribute to inadequate iron intake and iron deficiency. Iron deficiency can have significant consequences on your health. It can cause symptoms like we talked about before, such as fatigue, weakness, shortness of breath, and decreased exercise tolerance. Managing iron deficiency in CKD is essential. Your healthcare provider may recommend iron supplementation to replenish iron stores and stimulate red blood cell production. In some cases, intravenous iron or IV iron therapy may be necessary. In some cases, underlying conditions such as gastrointestinal bleeding or cancer may cause anemia that cannot be treated with iron supplementation or dietary changes alone. In these situations, blood transfusions may be necessary. However, it's important to discuss the potential risks and adverse events associated with blood transfusions with your healthcare professional before proceeding with that treatment option. It is important to work closely with your healthcare team to monitor iron levels, optimize iron intake, and address iron deficiency effectively. By managing iron deficiency, you can alleviate symptoms, improve your quality of life, and potentially enhance the effectiveness of other treatments for CKD. ESAs are medications that stimulate the bone marrow to produce more red blood cells, which can help address CKD-related anemia. There are several benefits and risks associated with using ESAs. The main benefit is that they can effectively increase hemoglobin levels and reduce the need for blood transfusions. However, there are also potential side effects, including high blood pressure, blood clots, and increased risk of heart attack or stroke. Additionally, some anemic patients may develop antibodies to ESAs over time, which can make them less effective. Dosage guidelines for ESAs use vary depending on the patient's individual needs and their medical history. Administration techniques may include injections under the skin, also known as a subcutaneous injection, or directly into a vein during treatment sessions for patients on dialysis. Cost analysis is also an important consideration since these medications can be expensive and may not be covered by insurance in all cases. While ESAs can be an effective treatment option for anemia in chronic kidney disease patients, it's important to weigh the potential benefits against the risks and consider individualized dosage guidelines and administration techniques. My favorite part, let's talk about diet and nutrition. To help improve your overall health and well-being, it's important to pay attention to your diet and nutrition when dealing with anemia caused by kidney disease. Here are 4 things you should keep in mind. Number 1, meal planning. A balanced meal plan can provide the necessary nutrients to help manage anemia and kidney disease. Your healthcare professional or a registered dietitian can work with you to create a meal plan that meets your individual needs. And also, I sell them on my website at renaldiethq.com. 2, nutrient deficiencies. Anemia caused by kidney disease is often due to low levels of iron, vitamin B12, and folate. Eating foods rich in these nutrients, such as leafy green vegetables, beans, nuts, and meats, can help increase their levels in the body. Dietary restrictions. Depending on the stage of kidney disease you're experiencing, you may have dietary restrictions such as limiting protein intake or avoiding certain foods like bananas due to high potassium levels or high sodium items. It's important to follow these restrictions as they play a role in managing anemia. Supplements. In some cases, supplements may be recommended if nutrient deficiencies cannot be addressed through diet alone. Some supplements given for anemia include ferrous sulfate, folic acid, and vitamin B12. You should consult with your doctor before starting any new supplements. Overall, making changes to your diet and nutritional habits can play a significant role in managing anemia caused by kidney disease. Consult with your registered dietitian for personalized recommendations based on your unique situation. Researchers are currently conducting clinical studies to find new ways of preventing, detecting, or treating anemia in individuals with chronic kidney disease. One focus is on the gut microbiome and its potential role in anemia development. Studies have shown that alterations in the gut microbiome can lead to inflammation and iron deficiency, both of which contribute to anemia. Researchers are investigating how changes in diet or probiotic supplementation can modify the gut microbiome and improve anemia outcomes. You may be wondering what the gut microbiome is, and it's the microorganisms, including bacteria, fungi, viruses, and other things that live in the digestive tracts of people and animals. The gut is the main location of the human microbiome. So it's developed based on what you eat and your environment around you. So they're trying to see if there's ways that they can adjust what you eat or give you different probiotics that will change the gut bacteria that you have that can then be beneficial to you. Another area of research is focused on novel treatments for anemia in patients with CKD. Some potential therapies include utilizing stem cells to stimulate red blood cell production, using gene therapy to increase erythropoietin levels, and develop drugs that target specific biomarkers involved in anemia development. A biomarker is something you do a lab test for. Researchers are also considering patient perspectives when it comes to managing anemia and CKD. This includes studying patient preferences for different treatment options and developing strategies to improve adherence to medication regimens. By understanding the unique challenges faced by anemia in people with kidney disease, researchers hope to develop more effective prevention strategies and treatments that better meet their needs. And you can read more about these and the studies I've linked to in my article in the description below. You should know that maintaining optimal hemoglobin target levels is important for managing your anemia and chronic kidney disease. Hemoglobin is a protein responsible for carrying oxygen throughout the body, and low levels of hemoglobin can lead to fatigue, shortness of breath, and other complications we've talked about. However, it's important to note that the ideal hemoglobin target level may vary depending on individuals. For hemoglobin, the target levels in patients with CKD are at 10 to 11.5 grams per deciliter. Using medication to maintain optimal hemoglobin levels is the key to managing anemia and chronic kidney disease. ESAs are often prescribed to stimulate red blood cell production, but they shouldn't be used to increase hemoglobin levels above 13 grams per deciliter. In fact, studies have shown potential risks associated with higher doses of ESAs, such as an increased risk of cardiovascular events. It's important for healthcare professionals to monitor progress and adjust treatment accordingly. Long-term effects of managing anemia in CKD include improved quality of life and potentially slowing your CKD progression. However, it's crucial for patients with anemia to work closely with their healthcare team to develop an individualized treatment plan based on their specific needs and medical history. Monitoring your progress through regular blood tests can also help ensure that optimal hemoglobin levels are being maintained without putting patients at unnecessary risk. Anemia is a common complication in CKD, affecting many individuals with the condition. The causes of anemia in CKD are multifactorial and include decreased production of erythropoietin, hemolysis, which is damage to your blood cells during dialysis, iron deficiency, and inflammation. Early detection and treatment of anemia can help slow the progression of CKD and improve outcomes for affected individuals. Symptoms such as fatigue, weakness, and shortness of breath can be indicative of anemia and CKD. Diagnosis can involve blood tests measuring hemoglobin levels and other markers. Treatment options include erythropoiesis stimulating agents, ESAs, hard for me to say, iron supplementation, diet and nutrition changes, and potentially clinical trials or research studies. It's important to monitor hemoglobin target levels during treatment to ensure optimal management of anemia in patients with CKD. Ongoing research is being conducted to further understand the pathophysiology behind anemia and CKD and to develop better treatments for this common complication.